So much for introducing me, Alex, and for inviting me here today. I feel incredibly privileged to be invited to speak. My name is Gemma. I'm a 25-year-old, 5-foot northerner and proud Mancunian. I like to think of myself as being a mix between an artist, researcher and change maker, and I'm particularly interested in person-centred and inclusive approaches to understanding the diverse lived experience of creative health. I'm a person with lived experience of using creativity to enhance my mental health myself. And while I tick the box of having said lived experience, I always like to emphasise that I identify as being much more than this alone. I'm a first-class graduate in human geography, and last year I conducted a piece of community research at a wonderful mental health charity in Manchester called 42nd Street, which has its own creative venue called the Horseful. At 42nd Street, I conducted a piece of research which produced a toolkit containing 12 effective components for best practice in non-prescriptive creative health, and the outputs of this have since been applied to alternative spaces such as CAMs, schools and shopping centres. At 42nd Street, I've also been the Associate Director of a campaign, festival and symposium advocating for young people's right to a creative life. And for anyone in the audience interested in health equity like above, I've been a reviewer, panellist and I'm now an advisor on an AHRC project called Mobilising Community Assets to Tackle Health Inequalities. However, most recently, I moved to the big smoke that is London and joined a graduate programme at the Wellcome Trust, 5 stops down the Northern Line, Bank branch. Why focus on creative health? As I stand here today as said person with lived experience, as much as I'd love to share with you a fairy tale or happily ever after, claiming that after painting 25 canvases, I was miraculously discharged from inpatient hospital, no longer depressed or grieving the loss of my best friends, unfortunately, I feel this would be a wildly simplistic assertion to make. So sadly, for the likes of Hobbycraft or Cass Arts, well, I'm not going to market to you that creativity is the new citalopram or CBT. What I can tell you is that what creativity means to me, why it works, and stress its absolute vitality as we face a dualistic crisis of rocketing waiting lists and mental health referrals. While it's hardly an accolade, I do consider myself to be a bit of a connoisseur when it comes to accessing mental health services, in that I've dabbled with varying success in a broad spectrum of what is offered. And when I initially, maybe 3 years ago, when I initially found out 42nd Street offered a creative programme, while intrigued, my automatic response was that a creative intervention for my mental health was the equivalent of sticking a wet paper towel on depression, in that it was both an action that would give me something to do, but it wouldn't necessarily make me feel better. So if you're in the audience and you're feeling slightly skeptical or unconvinced about the value of a creative health strategy, I can assure you I was once there myself. Next slide. While doubtful, without access to more traditional forms of care, I began using the creative space at 42nd Street, engaging in workshops and over time co-created an art exhibition which sought to enliven the lived experience of mental illness beyond its stigma and stereotypes. In doing so, art became not just an action, but it allowed me to feel and process experiences. The outputs enabling me to advocate for change. The process of using creativity to connect with and influence others inspired me to create this participatory art space map. This map illustrates over 100 young people's safe spaces in Manchester. And while the output is this huge illustrated map, unlike rigid models of therapy, which follow a fixed programme of talking through difficult experiences or planning the practicing of skills between sessions, this Shine a Light mapping project catered for my own individual needs. It not only allowed me the reflective time I needed to process the loss of one of my closest friends, albeit through smiles, laughs, the occasional tear or angry moment, but it also gave me a sense of joy and empowerment, cultivating a sense of agency and skill set that has taken me from an inpatient revolving door to resilient and thriving. In contrast to more standardized models, this project allowed me to self-prescribe the project which I needed, and in doing so, this became the recipe for my recovery. My interest in how creativity can indeed become a recipe for recovery drove me to start a community research project at 42nd Street. The project aimed to evidence if creative spaces improve young people's well-being. And despite academic glorification of outcome measures, the research has to be said. The research was ethnographic in nature and focused on creative methods of working collaboratively alongside young people to understand why these spaces work. While the outputs don't state that creative spaces increase a young person's well-being from a score of 3 to 9, the research brought attention to the fact that creativity for many young people is a lifeline, the best thing they've ever done for their mental health, or as making their mental health 10 times better than any other intervention. Not only this, but the analysis made visible 12 affecting components or ingredients that take place within a creative space, which are both evidenced and valued by young people. Spotlighting that in addition to being an action or opportunity to process, creative health encompasses freedom, belonging, validation, agency, and social connection, and it becomes both a safe and accessible space in a world of waiting, inaccessibility, and inequality. While everyone involved discussed each of these components playing a part in their creative health journey in different ratios, this highlights that unlike standardized approaches, the flexibility of a creative model focus on what works for who and why, attending to the diversity of needs young people have and the different pathways which recovery can follow. And this emphasizes my earlier point. A non-prescriptive creative space allows young people the freedom to self-prescribe a project which becomes their own unique recipe for recovery. A creative space not only mitigates a 2-year waiting list, but the skills and agency people develop through creative health begins to transform people's dialect around mental illness from one of being unwell and unable to do things to being an active agent in their own recovery. And every single person I've spoken to has expressed a desire for more. Hence why I chose to be a part of the Creative Health Review, and its person-centred and collaborative nature of the roundtables, its lived experience panel, and the recommendations made has meant it's only been a privilege to be a part of, and I really mean that. It's one of the most authentic lived experience panels and pieces of work that I've ever done. I live and breathe this work. Next slide, sorry. So despite thinking creativity was the equivalent of sticking a wet paper towel on my mental health 3 years ago. 3 months ago, on my first day at Wellcome, when I was asked what I would bring if I was stuck on a desert island in a perhaps less than creative icebreaker, my automatic response was to bring my watercolours. So I believe when it comes down to it, creative health is mental health. It's fundamental to my survival, but it's also fundamental to the survivals of those dependent on our healthcare system today.